Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Today our short talk will be about ethics of Hijama. Ethics of Hijama or ethics of cupping. I'm Hussien Nagi, paying consultant in Birmingham, UK. Ethics in medicine generally are based on four pillars. The first pillar is justice, which means to go by the legal obligations and law. Human rights, respect human rights, prioritize treatment and the resources available, and to justify the treatment and have fairness in distributing the treatment. The pillar number two, beneficence. Must do good for the patient, do no harm. Autonomy, freedom to choose freely where they are able to choose. This is from the patient point of view. So the patient should have the freedom to choose the treatment or no treatment, provided they can make that decision. Confidentiality, and we will talk about this in more details. So these are the basics of ethics in medicine generally. Each of them can lead to dilemmas, like for confidentiality. If you know somebody has got AIDS, but his wife is asking you, does he have AIDS or not? Do you reveal the confidentiality or not? And so on. So each of these are pillars of ethics, but each of them can lead to ethical dilemma, which are the subject of interviews, essays, etc. It's a big subject, but we are concerned today about the ethics when we practice hijama. So if we go back to history, we all, as doctors, have the oath of Hippocrates, which goes to hundreds of years before birth of Jesus Christ, peace be on him. But in our Islamic and Arabic history, this man is one of the fathers of modern medicine or medieval medicine that became the origin of the modern medicine. Abu Bakr al-Razi. He was born between 864 or 865 BC, EC. He wrote Kitab al-Hawi, or the one that conclude lots of knowledge, and he had a specific book called Akhlaq al-Tabib, the manners of the doctor. It's about 95 pages book. I scanned it and I found unbelievable tips, even valid till today. Talking about if you become a doctor of, you might become a doctor of a king or a prince or VIP or very highly intellectual person. So how can you deal with these people? You have to have more knowledge to be able to be modest, to be able to protect yourself from desires and lust and so on. Lots of beautiful tips valid till today. The modern medicine talk about good standards. This is from the General Medical Council in UK, have been published recently. What makes a good doctor? You have to have good standards during assessment, during diagnosis, and you have to treat patients as individuals, and you have to respect their dignity and privacy. There are applications of this. So good standards in assessment for Hijama, for instance, we are going to be obliged to have a very good history, a thorough history of past medical history, what treatment have been given, what medication, what are the limitations of the patient, any other systems affected, thorough exam or assessment in the history. We all, as doctors, know how to assess cardiovascular system, respiratory system, GIT system, neurology, sleep, etc. And they have a holistic picture of the patient or about the patient. This is in the assessment just for the history. Then when you put the diagnosis, you start as any medical students by what are the differential diagnoses? What are the possibilities? And then with more meticulous history taking and then examination, then looking at all the investigations available, you will start to focus this broad spectrum or maybe 4, 6, 5 differential diagnosis into the most common possibility or logic possibility, and then you start your treatment according to that diagnosis. You need to treat patients as individuals. They are not numbers. They are not patient number 1, number 2, or and so on. They are not processing a factory. You need to respect their time, their pace. Some of these patients will have slow movement. They come with pain. They cannot move, or they have a stroke, so they are shoveling in their gaits. Some of them have lost hearing, so you need to shout. You need to show them your lips while you are talking to them so they can read your lips. Some of them could be blind, so you have to be able to communicate well with these different needs of different patients. So each patient comes as an individual. Then you need to respect their dignity and privacy. Dignity, we all know in Arabic the word awra. I couldn't translate this word in English. It's private parts, but it is not private parts because we have awra, for instance, the ladies who are wearing or decide to wear hijab, their hair is awra. It's not private part. But so there is bigger explanation and the translation of this word. So you need to respect the dignity of the patient. If you uncover, you need to ask permission first. You need to ask them, what are you going to uncover, which part of their body, and why, and for how long. And then when you finish, you cover it before you expose another part, and so on. So this is the dignity of this patient, that the patient feel that they are always dignified as human beings. They're not a piece of flesh that one person just exposed, or maybe more than one person exposed if you happen to be teaching students as well. Privacy. You don't examine patients in front of other people, even relatives. You need to be able to ask their permission. Maybe they came in the clinic together, but when it comes to examination, they are shy to say, please, can I have a curtain or somewhere where it's only me that can be exposed, because they don't want to be embarrassed to ask this sister or brother or whatever to leave the room. We will talk about chaperoning in a minute, but this privacy of the patient should be respected all the time. Intimate examinations. If you are going to examine areas where they can cause embarrassment or distressing, these are the distressing areas for patients. For instance, examining the breast, genitalia, the rectum, not only these areas, even some patients touching them or coming close to them might make them distressed. Some nervous patients, some patients with paranoia, with disorder behavior and personality disorders, and some psychological issues post-traumatic stress disorder. Some of these patients do not like to be even in front of other people. There is something called Agarophobia. People are afraid of people. Some patients are afraid to be within a group of people. So you need to be very tactful to ask about this. Do you mind if we do this? Do you mind if you do that? Always ask the patient. And when the intimate examination, you need to make sure that you are doing it properly, as we will see in a minute. So before intimate examination, you need to explain why it is necessary to examine the breast or to look at the genitalia or the rectum or whatever the area. You need to ask, you need to explain to the patient that this is important for the full diagnosis, and that the treatment will not be complete or will not be proper without that examination. Then you give them questions to give them opportunity to ask questions. How long am I going to be exposed? Is it going to be painful? Who else is going to be? How are you going to do it? What are you going to wear in your hand? Will there be some lubricant or something to make it easier? Can I shout? What if I cry? Will you stop if I ask you to stop? All these, you need to let the patient ask all these questions. Then you want to explain what will it involve, to know what to expect, including any pain or discomfort. Yes, I'm going to examine, for instance, I'm going to examine your breast. It means I have to expose all the breast, both sides, till the belly button. You have to be sitting to see and compare the two sides. I'm going to palpate. First, I'm going to touch, and then I'm going to palpate, which means I'm going to squeeze areas to see if there are any masses under my fingers. I'm going to stretch the nipple to see if there are any discharge. I'm going to examine the axilla to see if there are any lymph nodes. So that way you are explaining to the lady, what do you mean by I'm going to examine your breast? This might be painful. If there is any lumps, you tell me as soon as you feel any pain, let me know so I don't press any harder, and so on. Then you must get the patient permission first, and the patient need to give that permission, not only verbal. Some of us will even write this either before or immediately after the examination. Consent was taken verbally by the patient at this time to do 1, 2, 3. So it is written and in the presence of, and then you write the name and the status of the person who is around. If it was your nurse or it was the sister of the patient or her mother, and so on. You must have chaperone. Chaperone, I don't know the name in Arabic, but there's somebody to accompany the patient, so you are not, what we call it in Arabic, khalwa. You are not alone with the patient. Some people nowadays even say, even if it is the same sex, 2 men, 2 women, you always have to have a third person. Some people go to that extreme to cover yourself from any allegations or any problems later on that, oh, he hurted me, or he did it without my permission. So this is like a witness in the place. You need to give them privacy to undress and dress. It is a very common mistake that doctors help patient to undress. This sometimes become like an insult to the patient, as if you are undressing them yourself. You need to give them the time to take off their clothes themselves. Maybe the chaperone or the nurse can assist in that only after having the permission of the patient. And then again, as soon as you finish, patient need to dress, you need to leave and let the patient dress themselves. This is not for you to be watching. Keep them covered as much as possible. As soon as you finish area, you cover it. As soon as you finish, you ask the patient to cover themselves and get dressed. do not help to undress unless you're asked. Some patients obviously might have shoulder problems, say frozen shoulder, so they cannot pull the t-shirt or they cannot undo the bra and so on, and they will ask you, sorry, my shoulder, I cannot do it, it's always my daughter who dress me or undress me. In that case, you ask them, will you allow me to do this? And then only after that you can do it. Children have special consideration here. If they have no capacity, means they are very young, say 2 years or so, they cannot understand, then you must ask capacity to consent to exam if they can give that. So if the child can understand you and can talk back to you and say, Habibi, Habibti, I'm going to examine you now, so I'm just going to hold your leg or shoulder, I'm just going to move it a little bit, it might hurt, but you will be brave enough, and so on. So you need to ask, is it okay to do this? Don't just grab the child and think that the child is just a piece of flesh in front of you. If the child lacks capacity or not cooperative, then you must ask the parents or the guardian permission. The parents in case of children, the guardians in case of the elderly who lack capacity. You might come across somebody who had stroke or dementia or Alzheimer, and they cannot communicate. In that case, you don't ignore them and just jump on them and start to undress them and move them, so on. You have to ask the permission of their guardian, whether the guardian is the son or the daughter or the wife, etc. You will ask their permission first. It is important that I examine, let us say, the knee of your mother. To do this, we need to expose it. We need to expose the other knee to compare both of them. I'm going to bend the thigh up and down to see the range of the movement. You might hear clicking, that is normal. She might be in pain. If that happens, I'm going to stop straight away, all these kind of things. So this is for the examination, taking history, dressing, undressing, etc. Then the ethics of the treatment itself. Now you're going to embark on the treatment. So you took the history, you diagnosed, you examine, the patient is ready now, you put a plan. They say, okay, I'm going to do hijama for al-kahil wal-ukhda'ain, the C7 and between the shoulders. These are the, let us say, these are the 3 sunnah points. And I'm going also to do the left shoulder, for instance. Okay, so you need to explain to the patient what I said. So there will be 4 cups, 1 here, 2 there, and 1 here. And then we are going to do this session. Now, maybe we are going to do it in 1 month and another month. So we're going to do 3 sessions, 1 month apart, and then we will see the progress of your movement, of your pain, of your sleep, and then take it further. And the patient need to know, when are you going to stop the hijama? Is it forever? Are you going to do it monthly forever? Or, as I said, perhaps we're going to do it 3 times on 3 months. And if they are not better, then we will try to find something else rather than hijama. So you need to have, I'm just giving example of a sequence of the treatment. Then, if you cannot make the patient better, you need to be able or to have the ethics to refer for further help in diagnosis. You've done your hijama points, you're sure of your diagnosis, the patient is not improving, then at that stage, you need to be honest enough to ask for further opinion, further investigation, or when you stop, you say, look, I cannot help you, or my understanding and capability of the hijama for your case stopped here. We cannot continue. You need to be able to assess the treatment success. What do we want to achieve with the hijama? Apart from doing the sunnah, okay, you do the sunnah, maybe once a year. Okay, and then what after that? You continue hijama weekly, monthly, daily? What is it that you want to achieve? Why are we doing the hijama? So you need to put a goal or goals. For example, we are going to do hijama, so you are able to raise your hand and be able to comb your hair, or able to reach for the shelves in the kitchen. Or we are going to do hijama, so you can sleep better, so the pain does not wake you up from sleep. Or we are going to do hijama, so you can reduce your tablets that hurt your stomach, so you are going to have tablet maybe once a day rather than 3 times a day. So all these are clear goals. So when you achieve them, you consider the hijama is successful. And when you don't achieve any of them, you need to be honest and say, I'm sorry, we didn't achieve any goals. We are not going anywhere with this treatment. We need to find something else or somebody else who can help. This is the ethics of honesty. Honesty about the outcome and likelihood of cure. Somebody come to you with cancer, terminal, secondaries everywhere. You need to be honest and saying, look, what we are doing the hijama for is not for the cancer to disappear. We have to be realistic, but maybe to have less pain, or maybe to have more ability to swallow, or to tolerate food, not to reduce the sickness, and so on, or to be able to have to sit on a chair rather than being lying down all the time because of the stiffness. So you need to have an honest outcome for the patient to agree on and to achieve, not to be promising false promises. Because false promises, number one, will make you, your picture will be shaken in front of the patient and the relatives and the other patients. Your reputation will be in jeopardy. Number two, the patient will not believe you in anything else. Children are very good at this. Once you lie to a child, this child will never believe you again. Why? Because they have fitra, they have inherited sense that a liar could be lying all the time. They don't fall in the same trap again. So they say, you said this before, I'm not going to believe you. So you said that this cupping did not hurt, but it hurt. So I'm not going to believe you that it will not hurt again, and so on. So you need to be very honest and very open about the likelihood of the treatment. Is it going to be painful? Is it going to be itchy after that? Will it cause scarring? Yes, it will cause, it will make some scarring. Maybe you need to have some pictures of scars of hijama to show them it's going to be scarred like this. Is that so bad to have scar like these scratches and at the back? Who is going to look at these scars? Are you happy with this? Is this something that you will be, you'd rather have your pain rather than this scar? And so on. Finally, the ethics of confidentiality. Confidentiality, sir, secrets of the patient. This is, you are the safety lock with their secrets. The patient details, you are going to write these documents, and these documents will be in your house. It can't be left and right on desks. Anybody go into your room, or another patient come and see the name, the age, the condition, what the medication, and so on. All these secrets about the patients shouldn't be spotted by anybody else except yourself and the staff that work for you. Details of individuals, conditions, in conversation, not only in writing. You can't be saying, I'm practicing ethics, if you share a story, say, you know who came today Mr. X, and he had this and that, and you start to talk about Mr. X, all details of past medical history, and that he has pain and he cannot sleep, and his wife is upset because of his snoring, and so on. These are secrets. You shouldn't be part of your discussion with anybody else. There are lots of concerns with VIPs. I'm highlighting this because eventually you will have one or two VIPs as your patients. Some doctors, unfortunately, make it like advertisement, a propaganda. أنا بعالج فلان أو أنا بعالج فلانة. The minute they know you might be specialized in gynecology, so once you mention the name of person who come to you, then you already revealed the secret that this patient has got a gynecology problem or a heart problem or so on. So be very careful not to be tempted to say and to talk, especially about the VIPs who come under you, because it's a big trap. Yourself, your ego want to share this, to use it as propaganda. You really need to be very, very strong to not to reveal this, obviously, unless you take a permission from that. So maybe there's a football player, famous, came with a knee injury, you put some cupping and the knee became good, and he went back to the game much quicker than the previous injury where he had no cupping. So you before you say Captain X came, you need to ask, do you mind if I mention your story, even on a TV program or in my Facebook or whatever? Only if you take permission, and that permission need to be probably in writing nowadays. People change their minds, and I don't want you to be under attack by anybody. Taking pictures or videos, very important. So many people take pictures of the Hijama setup or session without asking patient's permission. In UK, even if you cannot identify the patient, even if the picture is from behind, even if it is X-ray, you cannot share this without the patient permission. They gone really very harsh on this. Confidentiality is there, practiced in a very, very high standard. So no pictures, no videos to be taken, not alone to be shared, but to be taken, to be on your mobile is criminalized here in UK. Why? Because your mobile may become lost. Then somebody else open the mobile. You might lose it. Somebody might come hack your mobile and take all the details and the pictures. So be very, very careful. If you have it, you need to have double or triple security, and you must have the patient consent for this. Consenting before publicity in any way. As I said, if you're going to do any publicity, I know we all have the good intention that we want people to know about the good effect of hijama and cupping and how beneficiary it is for people and so on. But with that good intention, it's not enough to allow the system to let you get away with publicity and sharing people's secret. Okay, I will stop here. Hopefully, I covered most of the ethics that we need to talk about, from taking the history, from the diagnosis, examination, planning the treatment, during the treatment, when to stop the treatment, and the general akhlaq, manners of the doctors that you all know of, as we've been raised as doctors. The word doctor translated in our literature as Hakim. Hakim means the wise man. So part of the wisdom of the doctor are all what we talked about. Not to reveal secrets, when to talk, when to stop talking, when to listen, when to share the information, when to ask for help, when to stop offering help, and so on. So all these are the ethics. There are other issues, obviously, of trying to help the needy and the poor as the wealthy, try to be modest, try not to insult any patient, try to talk to the patient in the language that they understand, try to be smiling, welcoming, making the patient feel at home. Don't reveal any secrets, not alone about the patients, but about their environment. You don't say, I went to this patient's house. You don't talk about the patient condition, but you say the house was dirty or their children were filthy or so. All these are part of the akhlaq and the manners of a good doctor, and this is where I go back to Al-Razi was saying one of the beautiful things about the doctor that the patient يشتاق إلى الطبيب كما يشتاق لله. Subhanallah, ولله المثل الأعلى. I will say this in Arabic first, that المريض يشتاق لرؤية الطبيب لأنه بيجد عنده الطمأنينة والراحة يعني هذه من لطائف الرازي. الرازي was saying something very nice, that he said one of the attributes of the doctor comes from the attributes of God in relationship of God and people, that people are longing to see Allah, longing to meet with Allah because of the blessing and mercy and comfort and the reward that they will have with him. Same feeling need to be from the patient to the doctor. You know, a good doctor, that the patient will be happy to see that doctor because they feel the comfort is coming, the wisdom is coming, the gentleness is coming, and so on. May these words be remembered by all of us. I sometimes, obviously, all of us, during the quick turnover of patients, sometimes we become short-tempered, sometimes we forget one or two of these, but it's good to remind ourselves and to make it habit. And if we already acquired bad habits, to start to remember these and change our habits to better ones. May God help us all to honor this hijama that we are practicing, because after all, as we said at the very beginning of all these conferences, we are practicing sunnah of the Prophet, peace be on him, and we want to be honoring that sunnah as much as we honor any teaching of the Prophet, peace be on him. Thank you very much for your time listening, and we'll take some questions maybe in another session. Thank you. Assalamu alaikum.